So my talk is on prevention of infection, and I'm sure that a lot of things have already been highlighted during the previous presentations. But how do we reach to zero infections? Is it possible? Is it doable? I think this is already possible and doable. We are learning this from the Western world that infection can be zero. In fact, there are some units in the Western world, they're saying that if a baby gets infected or a late onset sepsis, the treatment is free. The burden of treating that patient will be on the hospital. So I think this is the challenge which people are taking up in the Western world. And it is time that we look at our preventive strategies to prevent infections, because infections, especially the late onset infections, are preventable. And all of us should work together to prevent these life-threatening problems for the newborns. I remember the word from Dr. Owen Bakhu, who is a founder neonatologist in this country. He said, follow the microbe in its journey from hospital environment to the bloodstream of the neonate and examine the processes that we can adopt at each step to reduce the burden of neonatal sepsis. So this is a wonderful statement where we need to understand from where the bug is coming to the NICU, how the bug is coming and proliferating in the NICU, how it is spreading from one baby to another baby, and if it comes to the baby, how it enters the baby, and even if it enters the baby, how from a bacteremia it becomes septicemia or infection, and how do we improve the susceptibility of the baby, and lastly, what administrative practices are required to prevent infections in the NICU. So the first point is, how do we prevent the microbe coming to the NICU? So for that, we need to ensure that our delivery rooms are clean. All of us follow the 6 cleans at birth. Dr. Subramaniam has been always telling us from the beginning of this symposium that we need to strike at the community. We need to work on the community to prevent infections. I agree with him that a lot of things come from what basic practices we follow to prevent infections. Ensure clean immediate environment around the NICUs, and always wash hands before you enter the NICU. Clean water should be available for washing always 24/7 in all the NICUs, and elbow operated tops are a must. Gowns and slippers are not mandatory, but if you wear it, it may be to restrict the entry of everybody coming into the NICU, but it doesn't help in preventing infections by itself. Air changes, if it's a closed unit and if you have air conditioning, you should ensure that air changes are at least 6 to 8 fresh air exchanges per hour are available in the NICU. One very important threat which comes from all of us is the mobile phones. NICU should be mobile free zone. So I think we all should ensure this culture that we do not bring mobile phones into the NICU, and maybe one phone which is uniform for the NICU, where we can take the calls, but all our mobile phones should be kept outside the NICU. I will show you some studies how mobile phones are dangerous. Location of the NICU should be as close to the labor room in inborn units, away from the septic labor room, away from other intensive care units, so that there is epidemic in one unit doesn't come to the other. And NICU should have a control as access, either a security sitting there or a thumb imprint allowing the doors open, or an iris opening. These are the ways to prevent entry of people into the NICU. And traffic other areas should not be through the NICUs. If you have a large hospital, it should not be, the NICU should not be thoroughfare area. The wash basin should be at entries. These are some of the guidelines. What should be the length, width, and depth of the wash basins? I'll show you the wash basin should be there, which should be there in the NICU. They should be having a slope. There should be sealed wall around the sick. Liquid soap should be available. There should be a tissue for hand drying. Trash bin should be there around the sinks for throwing the paper which you clean, and avoid leaks. Dripping water is a source of infection, and have non-contaminated water. So reverse osmosis plant should be available if you're planning NICUs, because the water itself may be contaminated with which you are washing your hands. And there should be facility for both warm and cold water inside the NICUs. Best is to have a timer, because before we enter the NICU, we need to supposed to wash the hands for 2 minutes or at least 1 minute. And before touching a baby, at least 30 to 40 seconds hand washing should be done, or hand rubs can be used. So this is the type of wash basin we should be having, where you have the liquid soap, where you have a hand dryer, where you have a timer, and where you have a poster and a trash bin to collect all the waste which you collect at the end of drying your hands. So there should be a ante-room before you enter the NICU. and the chapel should be kept outside the NICU, and you should wear a different chapel when you enter the NICU, and the ante-room should be clean. So we are looking at NICUs which are now family-centered cares, and this is what is going to be the change in future. You will see that baby and the mother and the father and the family sitting there, and probably the nurse, one nurse is going to dedicate herself to the care of these babies who are sickest. Mobile phones, there is enough evidence that 70% of mobile phones are contaminated. Maybe you can check the organism on your mobile phone. You can know what organisms are growing on your mobile phone. They are carrying Pseudomonas and Staph aureus. So one single intervention which all of you can easily adopt is make your NICU's mobile phone free. So if the microbes has come into the NICU, how do they spread? You can prevent the spread by one single step, that is housekeeping. Housekeeping means how do you clean your walls, how do you clean your floor, how do you clean your roof, and how do you take care of spacing, air, and water. So to prevent proliferation, the most important step is housekeeping. And in the housekeeping, remember the word dry, clean, dry. Dry means there should not be any wetness anywhere in the NICU. Clean means visibly clean everywhere. So there are certain areas where microbes proliferate, and these are the wet areas. So there should be adequate spacing between the beds. There should be good air circulation inside the NICU. There should be water, and wet areas should be avoided. So look at the wet areas and water areas, because they are the source of proliferation of the microbes. The waste management should be perfect. There should be 3 bins for at the baby bedside, and also in the NICU there should be a collective trash collection of the 3 or 4 bins. Drug and medication area is a very important area, because this is the area where the microbes can get an access to get into the baby. And doctor nurse stations are the areas where the microbe can proliferate, and also on the files and reports. So space wise, every NICU requires about 10 square meters or 12 square meters. There should be 2.4 meter distance between the 2 beds. That means there should be at least your arm length or more than your arm length between the two beds. The maximum distance for the sink cannot be more than 6 centimeters, and the minimum distance should be at least 90 centimeters. So at least for every 4 beds, you need 1 wash basin. The floor should be cleanable. There should not be crevices or penetrations, because they will harbor the microbes. The walls and ceilings also should be cleanable and washable if possible. So having tiles or vitrified tiles might be a good option. So this is the type of NICU one aims for: clean, dry, and adequate spacing, good circulation, air circulation. You can see that there is 1 wash basin here for 4 beds, which is quite decent for every 4 beds having 1 wash basin. And you can see the 3 bins next to each bed. Unit temperature should be between 22 to 26 degrees Celsius. Humidity should be around 50%. As I said, at least 6 air exchanges if you are using air conditioning. There should be HEPA filters if you are closed unit which has air circulation. RO water should be available. Water should be 24/7, and you should use clean water in the oxygen jars too. Distilled water or sterile water should be used in the humidifiers and not clean water. Clean water can be used in the suction jars or oxygen jars, but sterile and distilled water should be used in the humidifiers. So you need an NICU like this, and NICUs where there is overcrowding are likely to lead to infections. So you need good wash basins. There should not be any dripping of water around the wash basins and inside the wash basin too. So you need the color coded bins. We remember the simple mnemonic: kala kachra, or the blue or kala is the black. All the kachra, the day waste, the waste which you collect at home can go into the blue or black bin. Pila patti, all that is having secretions, body secretions, should go into the yellow bin. And lal plastic. So all that is plastic or infected should go into the red bin. And if it's sharps or if it's contaminated, they should go into the white bin after which has been decontamination. And if there is blood clot, they should be cleaned with hypochlorite solution. These are the wet areas of the NICU, the refrigerators and the medication areas. And the medication areas could be laminar flow, or wherever you're making your medication, if they are wet or if they are dirty, they are likely to grow microbes. So all the wet areas are the drug making areas, the refrigerators, the wash basins, and the suction jars and the humidifiers. Now a small question for all of you. I will give maybe 10 seconds. Name the bacteria that grows in stock solutions. If you use stock solution shared between the babies, you're likely to get epidemic of this infection. I will just give 10 seconds for all of you. So most of you are correct. Yes, it leads to Pseudomonas sepsis. Pseudomonas is one organism which can grow in stock solution. So avoid stock solution for flushes, avoid stock solutions for suction catheters, avoid stock solutions for sharing between the babies. Every baby should have a small ampule or a vial, which you can use as a saline vial or a distilled water vial, where you can flush the cannulas and use them for ET suction too. So if the microbe has proliferated in the NICU, it needs to come to the baby. So we need to prevent baby to baby spread. So the first point I said is to prevent entry, hand wash and prevent mobile phone. To prevent proliferation, good housekeeping, clean and dry NICU. Look for wet areas and keep them clean. And the third point is how do we prevent baby to baby spread? For this, one important word you have to remember is disposables. The more number of disposables you have, the lesser will be the chance having baby spread. The second point is having adequate nurse-patient ratio. This is the biggest problem in both private and public hospitals. More so in public hospitals, I think each one of us should ensure and struggle to get the adequate number of nursing, because they are overburdened, they are overstressed, they do double duties, triple duties. So we should ensure that if there is a ratio which we need to follow, nurse-patient ratio, we need to bring it to the planners to ensure that adequate number of nurses are available for the type of patients which we treat in our NICUs. So nurse-patient ratio and disposables are the clues for preventing baby to baby spread, apart from your hand hygiene. So hand hygiene, all of you know the 6 steps of hand hygiene. Please follow them. And if you're using hand rub, you need to spend at least 40 to 60 seconds. Follow all the 6 steps and ensure that each step is carried for 5 times to ensure that your hands are clean before touching a patient, after touching a patient, after touching an environment, after doing a procedure, and before doing a procedure. So these are the 5 moments of hand hygiene which you should follow. There are certain conditions where you have to wash hands, and washing hands is required when you enter an ICU, when you do a procedure. Before doing a procedure, you need to wash your hands, and when you're touching wet areas or wet secreta, you have to wash your hands. Other times you can use hand rubs. So these are the 5 hand movements. So always have one hand rub next to the baby, so it should be easily accessible. Doability is possible only when you have accessibility. The more near the baby or more near your hands the hand rub is, more likely you will follow it. This is one blessing in the disguise. Like during the COVID time, I think hand rub have increased. The hand hygiene is increased because we ourselves are at risk if you don't take care of hand hygiene. So always bare below the elbows. Your sleeves should be above the elbows. And this is one principle which you need to follow if you are entering the NICU, bare below the elbows. Then no nails, no nail polishes, because under the crevices of the nails, the bacteria could grow and could spread from one baby to another baby. And no bangles, no bangles, no rings, and no jeans. I'm not against jeans, but you tend to reuse the jeans. Try to, if you're using jeans for 3 to 5 days, they could spread from infection from labor room to septic labor room to NICU to PICU to all the areas it might carry the microbes, and they could be the fomites. And avoid using the bangles and rings, because they could be again sources of fomites, and you may not be able to clean those areas under these nails, bangles and nails always. Have baby belongings. Every baby should have its own stethoscope, its own measuring tape, its own suction catheter, its own the BP cuff, so thermometer. So there should be minimum basic kits which should be available with every baby, as you can see here, and its own hand rub too. So as I said, one more very important, apart from disposables, the second important aspect I wanted to stress was nurse-patient ratio. If for normal routine care, you need at least 4 babies, 1 nurse should be there in each shift. If you're doing intermediate care or like gavage feeding or oxygen or fluid care, you need 1 nurse for every 2 to 3 babies. If you're doing intensive care like CPAP, HFNs or normal ventilation, you need 1 nurse for every 1 or 2 babies. And you're doing multi-system support like TPN, ventilation, infusions, then you need 1:1. And complex procedures like INO, therapeutic hypothermia, you may require 2 nurses for 1 baby. So this is the protocol we need to follow to ensure that adequate nurse-patient ratio is available in the NICUs. NICUs are ICUs. They're not general wards. We need to stress on the planners to say that if you're creating NICUs, please consider them as ICUs and not as general wards, because your nurse-patient ratios should be based on the ICU strategy and not based on ward strategy or a pediatric ICU or an adult ICU. Here, we need more patients to care for these tender babies. If you can see on the x-axis the nurse patient ratio and the y-axis the incidence of infection. If your nurse patient ratio is poor, that is in the x-axis you're moving towards the right, your nurse patient ratio is poor, and on the y-axis you have the infections. If your nurse patient ratio is going down and down, your infection is going to going up and up. A one standard deviation higher amount of nurse understaffing per patient or per infant was associated with 40% increase odds of having infection. So this is one very important strategy to prevent infections. Manpower matters, and matters mostly when we are dealing with newborn babies. So there should be a need for isolation room, because if an infected baby is coming to you, either you do a reverse cohorting. That means you keep the baby and you take care of all the precautions when you're touching the baby before and after touching, or keep this baby isolated or cohorted in a different room. And this room should have negative pressure, separate air conditioning, and a separate person should be taking care of this baby. There should be a dirty utility room in all the NICUs, so that all the waste, that is the bed sheets and those things which come from the use, like your instruments, they should be all going there, get clean, and then they get go for autoclave and they come to the clean room or storage room. Now we have said that prevent entry by hand washing and mobile phones, prevent proliferation by housekeeping, prevent baby to baby spread by disposables. And how do we prevent entry of microbe from the baby? It has come to the baby and settled on the baby's body. How do we prevent entering the baby? So very simple. Take care of the cord and skin. So clean the eyes at birth with 2 separate swabs. Keep the umbilicus dry and follow this bundle approach, because only when you break the barriers, the microbe enters. For intravenous care bundles, you can do central line bundles, VAP bundles, and nutritional bundles. These 4 bundles are likely to prevent entry of microbes into the baby. So we have touched on this. Our first speaker, Venkat, our second speaker, Venkat, has told the importance of Vernix. Never remove the Vernix from the baby. And use disposable diapers in the NICUs, because the nursing staff will not be able to take care of the cloth diapers. They need something which is easy, and at least 8 to 10 diapers per day are required for each baby in the NICU. And when you're using the IV, when you're using the other diapers, there is likely that you might bathe the baby with urine and stool, and that would increase the colonization of the skin and also lead to more infections. We have ourselves have shown that using disposable diapers is cost effective and decreases the infections. The incidence of probable sepsis significantly reduced with the use of disposable diapers. This was in early 2005 or 6, we did this study, and the infection rate came down from almost from 45% to 28% by using only diapers in that unit. IV care bundle, hand wash, have everything ready, the IV cannula, the saline flush, betadine, spirit swabs, and the sticking ready before you start the bundle. Clean with betadine, clean with spirit, betadine, and then spirit. Give 1 minute time after cleaning with betadine, and put the cannula, flush it with saline. Do not allow blood to drop out. And after you flush it, fix it with a transparent dressing, connect a 10 centimeter extension, and to these 10 centimeter extension, have a heavy fluid through an infusion. And remember that the pediatric drip set is connected to a saline bottle, so that you don't make and break the circuit before it goes to the patient. And after you do this, again, do the hand hygiene. CLABSI bundle is a central line bundle. You have to take care of certain things before insertion and certain things while the maintenance. Hand hygiene, barrier precaution, chlorhexidine skin prep, or the spirit, betadine, spirit 3-step process for line insertion. And during maintenance, ensure every day for inflammation, every day for the entry point for any signs of inflammation, and use it only for TPN or for infusions and not for blood drawings. VAP care bundle, if the babies are on ventilator, follow this VAP care bundle, that is hand hygiene, endotracheal tube care, head end elevation by 30 degrees, stress ulcer prophylaxis should be avoided. Do not use routine ranitidine or any other medication. Get the baby out of sedation as early as possible. Maintain oral hygiene of the baby while the baby is having ET tube with colostrum or mother's milk, and make an assessment to wean the baby from ventilator as early as possible on every shift and every round. So I would have one more poll question. So identify the photograph with the wrong VAP bundle approach. So there could be 1 or 2 on this. So I'd request all of you to take few seconds to answer. A, B, C, D. 1 or more of them are wrong practices for VAP bundle. Wonderful. I think most of you are correct. A and C are wrong. A, because the tube is hanging vertically. The tubes nowadays, we say that they should be parallel to the baby because the condensate should not go into the mouth and ET trachea, ET tube. And the second, there should not be any condensation in the inspiratory limb. Otherwise, it will lead to colonization and infections. So we have looked at the bundle approach to prevent the entry of microbe into the baby by IV Care Bundle, by the CLABSI Bundle and the VAP bundle. But if it is increased, if it is the bacteria has gone into the baby, how do we prevent a bacteremia becoming a septicemia? How do we prevent a bacteremia becoming septicemia? Septicemia is bacteremia with clinical signs and symptoms. So how do we prevent bacteremia becoming septicemia? For that, we need to boost the immunity of the baby. And the best way to boost the immunity of the baby is by using mother's milk or aggressive enteral feeding and promoting mother's care by the baby, mother taking care of the baby, like skin to skin contact, kangaroo mother care, mother changing the diapers, mother involving in the baby care activity. So 2 important interventions, that is mother touching the baby, handling the baby, taking care of the baby, and giving feeds and doing skin to skin contact are the measures to improve or boost the immunity of the baby to prevent a bacteremia becoming septicemia. So all NICUs should have adequate number of breast pumps because the small babies may not be able to suck from the breast. They need to give express breast milk. So ensure adequate place for the mothers to sit around and ensure that they pump the milk and give it to us as many times as possible, as early as possible. We should start pumping the milk right from the birth. Baby comes to the NICU and ask the mothers to pump 8 to 10 times a day and ask them to pump at least 2 to 3 times in the night. And they should send this milk to the NICU as many times as possible so that babies are on exclusive enteral breastfeeding, EBM. So, or if you're not able to have frequent milk, or if mother's milk is not available, try to have a donor human milk like what we have in Nilafur, the Datri Milk Bank. So we should establish more of these milk banks in public hospitals and also in private hospitals wherever mothers are available, and have small milk banks where you can store the mother's milk as long as 6 months. Kangaroo mother care should be part and parcel of all the NICUs, right from the word critical time to the stable time till going home. Kangaroo mother care should be promoted. It will ensure that the flora of the mother comes to the baby, the gentle, friendly flora of the mother comes to the baby. Mother's milk output increases. She will be able to give more express breast milk, and she'll be giving a friendly bacteria to the baby, which will help in improving boosting the immunity of the baby. The last procedure is improving the admin practices. We should ensure that the nurses, the class 4, the resident doctors, and the unit head, as well as all the administrative staff of the hospital are all inclined to decrease infections. All our goal should be to prevent and decrease infection as much as possible. So for that, we need to have a culture of sending blood culture before starting antibiotics. Every unit should have a written antibiotic policy. We're going to delve in depth in the next panel on this. Restrict the use of reserve antibiotics. Have written infection control protocols. Though there should be a checklist by which every shift, who is doing what work, who is cleaning the floor, who is doing the wall cleaning, who is cleaning the equipment, and how much time the disposables are replaced, how the hand hygiene is being maintained, how the running water is maintained. All this should be made into a checklist, and then we should follow them. There should be a hospital infection control committee, or at least 2 or 3 people dedicated to take care of infections in all the hospitals. We should continue to motivate the staff, and leadership should be coming from the nurses. Nurses are the backbone. So having adequate number of nurses and empowering them will help us in decreasing this infection rates. And if there is an epidemic, it should be dealt with early and aggressively. So to summarize, This is the last slide, and again I want to poll. So I've summarized this in this slide. Remember the journey of microbe: prevent proliferation, prevent baby to baby spread, prevent entry of microbe into the baby, improve the immunity of the baby, and have a strong admin and will. So in this 4 points ABCD, one match is wrong. So please identify the wrong match. Please identify the wrong match. So can anybody tell me what is the right match?
Breast milk.
Wonderful. So breast milk or nutrition is the best match for this thing. Nutrition, mother's own milk, breast milk, and aggressive enteral feeding is what we should have to improve the immunity of the baby. So these are some of the closing tips for all of you. Diapers, having hand rub for the baby, the VAP bundle, keeping the ventilator tubing on the side of the baby, wet areas, having no leaks. There should be a waste bin, there should be hand dryer, there should be a poster to help people to wash hands or how to wash hands, the wet areas or drug making areas, the refrigerators or the wet areas, then having breast pumps and promoting kangaroo mother care, and the other water management, like here there should be clean water. You can add a little bit of Savlon to prevent proliferation of microbe, and then the water in the oxygen jar should be clean water or drinking water, and water in the humidifier should be water, distilled water and sterile water. So restrict the use of cephalosporins in the NICUs. In our unit, we rarely use cephalosporins. Out of maybe 10 out of 1 baby gets cephalosporins only when they have meningitis or when we don't have anything else to treat. So cephalosporins are the bad antibiotics which will promote lot of cross resistance. So thank you. Remember to be NICU to be clean, dry, disposables having plenty, and having bundle approach. And lastly, involve the mother in baby care with her skin to skin contact, her breastfeeding and breast milk. Thank you. I can take some comments or questions. I don't see any comments or questions coming. So I think it was a marathon for prevention of infection. So
no, your presentation was so excellent. You didn't give us any chance to ask you any question.
Thank you, sir.
As always, it's lucid, succinct, and practical translation.
Thank you, Vijay. And I hope people remember at least 4 points. That is, mobile phones prevent entry. Second, take care of the wet areas in the NICU. Third point is the having adequate number of disposables. The fourth point I made is nutrition bundle or bundle approach. And lastly, involve the mother in baby care, right from skin to skin breastfeeding and also in all the other baby care activities. So I can see one question: any incubator related risk of sepsis in incubator? Anything which you use can have risk of infection. So how well you can take care is more important than the gadget. Okay, I think I've taken more time than what I committed. I'm sorry because I overshoot by 5 to 10 minutes, but I know Vijay would excuse me for that. So Vijay, the floor is yours. This is the last session for the single team session, and